This video will introduce the 10 basic techniques of feeding assistance skills. The older adult population is rapidly increasing, and the number of people requiring assistance is also on the rise. As part of nutritional care, the importance of feeding assistance is being increasingly recognized. There are numerous feeding assistance techniques in medical and nursing care settings. However, it has been difficult to evaluate which techniques are essential and whether caregivers have sufficiently mastered them. The experts in feeding assistance selected the 10 basic techniques. These techniques were verified for reliability and validity in medical settings and were developed into an objective assessment tool with a 3-level rating scale. Mastering the 10 basic techniques of feeding assistance skills can help your care recipient increase their food intake, increasing both care recipients' and caregivers' satisfaction. The 10 basic techniques allow people without specialized knowledge or experience to learn the basics and necessary techniques objectively. The 10 basic techniques of feeding assistance skills are balance, sole, chin down, residue, scoop, hand, spoon, removal, show meals, and pace. Now let's look at each technique in detail. Step 1. Balance. Make sure the care recipient is not leaning on either side. Check from both the front and the sides before starting, and use your hand or any support to adjust if necessary. Step 2. Sole. Make sure the care recipient's feet are flat and firmly placed on the floor. Use a footrest or similar support if the feet is not reaching or firmly placed on the floor. Step 3. Chin down. Adjust the care recipient's head and neck so they are bent slightly forward. If a reclinable bed or chair is used, raise the backrest and ensure they are seated deeply for support. Step 4. Residue. Check that there is no saliva or phlegm accumulated in the care recipient's mouth before the meal. To confirm, have them to speak or open their mouth. Step 5. Scoop. Scoop the food within a sight of the care recipient. Scooping from lower than their eye level makes them easier to recognize the food. Step 6. Hand. If you are assisting from the recipient's right side, hold the spoon in your right hand. If you are assisting from the left side, use your left hand. Avoid using a reversed hand. Step 7. Spoon. When bringing the spoon to the care recipient's mouth, approach from below the chin so they don't have to lift their head. Avoid approaching from above. Step 8. Removal. After inserting the spoon, gently pull it out by brushing it against the care recipient's upper lip. Avoid pulling it straight out horizontally. Step 9. Show food. Place the meal tray where it is fully visible to the care recipient so they can recognize what they are eating. Avoid placing it where it can be hidden from view. Step 10. Pace. Scoop and prepare for the next bite before the care recipient is finished with their chewing to maintain their pace. Waiting for the next scoop until chewing is finished can disrupt the rhythm of eating. Observe carefully and prepare with the care recipient's pace. Mastering the 10 basic techniques of feeding assistance skills by caregivers will maximize the support and improve the quality of life of those who need help.